My name's Scott. I'm Scott Smith. I work with Dr. Herring here at OrthoVirginia as one of his clinical assistants. We do everything as far as bringing the patients back for the initial intake, ordering tests. So there's some other paperwork involved, disability paperwork. Helping to schedule surgeries. We do a lot on a day-to-day basis. It keeps us busy, but I love it though. I like to be up and active, and moving. So this job's perfect for that. I've always been kind of interested in orthopedics. It's funny. I actually used to work with advanced orthopedics, light years ago, and then we ended up merging several years ago with OrthoVirginia, and I stuck with it. And I've always enjoyed the type of, orthopedics in general, the type of medical practice this is. I don't know. There's something about bones, I guess. I don't know if that's so vague, but I've seen friends and stuff with broken bones as a kid, and I had some myself, and so I was like, I always was interested in how they fixed that, and it's pretty simple, really. But I've always enjoyed it though, and helping people, the doctors, and helping the people recover and everything. The rehab process, it's fulfilling to see that. Well, I'd say one of my favorite things about working here is, I've worked at a couple different offices. I know we have a lot of, teamwork. Our shirts, stronger starts here. That can mean like so many things. But the teamwork, I would say, is good. We all kind of jump in and help each other out. I do like also that we have several offices around the Richmond and, statewide, up in Northern Virginia too. So we kind of touch all the different regions in the state, for people with their orthopedic needs. It's nice to have that large network like that too. This side of the river, the other side of the river, you hear that a lot. But yeah, it's just good. It's just a good practice all around, as far as, the expansion and everything that they've done as well. It's continuing to grow over the years, which is awesome to see. I would say try not to get overwhelmed too quickly. I know, because there's a lot of stuff that goes on the screen, especially with our Epic system and everything. I could tell from experience too that I was kind of like that. I would say just take it one day at a time, and you're not going to learn everything all in one day. We've seen people get stressed out or burned out too quickly, and we want to try to steer away from that. So helping to shadowing other people in clinic is very helpful too, just to even before they do their training, just to see what they do on a day-to-day basis. So help them be more prepared. But I would say compassion, I guess. Compassion, that's the first thing that comes to mind. Compassion for our patients. We forget that a lot of or it's important to remember that a lot of people that are walking through these doors every day are in a lot of pain too, and try to, if I was to put myself in their shoes, I've been hurt and broken bones and stuff before, and there's certain things that they need that we need to provide for them, and but just remembering to have that compassion for them, for everyone that comes in here. Sometimes we can get caught up on the day-to-day things at work, and I know we get busy and stressed out sometimes. So, but at the root of it all, that's why we're here. Well, I was with Advanced back in 2010 when they were switching everything over from electronic medical record, or switching everything over to electronic medical records. And I used to work with another joint surgeon here who's now retired. And so when we merged, I guess it was 2016 or something, I started working with Dr. Herring probably back in 2015 or 2016, somewhere around there. The years all kind of blend together after a while, but no, I've really enjoyed working with Dr. Herring and his team. They treat us with respect too. It makes coming to work, enjoyable, more fun too. When you get that mutual respect with, staff and everything. So yeah, it's been a pleasure.